At the E.L. Spencer Jr. and Ruth Priester Spencer Cancer Center, we understand the importance of being home when facing the difficulties of a cancer diagnosis. Throughout a patient's journey, our team of cancer specialists provide patients with care for their mind, body, and spirit, while also ensuring the luxury of receiving treatment close to home. Our team of experts specialize in early detection, diagnosis, and treatment of all major forms of cancer. Some of the more common cancers we treat include breast, colorectal, gynecologic, lung, and prostate. Since opening in 2019, Spencer Cancer Center has served hundreds of patients across the East Alabama region at our state-of-the-art facility. Patients are guided each step of the way, from diagnosis to remission, and receive counsel on topics such as community support resources and financial planning. We understand that no two cancer journeys are the same. Because of this, treatment plans are comprehensive and individualized for each patient. Treatments include, but are not limited to, chemotherapy, radiation therapy, and surgery. Down the main hall is the Infusion Bay, where treatment is administered. The Infusion Bay is designed to provide patients comfort and support in a relaxing environment as they receive treatment. Patient safety is of the utmost importance. Treatment is overseen by a multidisciplinary care team.
We do a full range of hematology and oncology services here. We handle basically any hematologic or oncologic diagnosis that you can think of. We handle immunotherapy, blood transfusions, hydration therapy, and of course chemotherapy. Our infusion room handles anywhere from 26 to 28 people comfortably, and that's with guests. Wait times for infusion are relatively short, so if I see a new patient and want to start them on chemotherapy, that's about 3 to 5 day wait on average. We do not limit the patients that we see here in the clinic based on their diagnoses, so those patients would all be seen in follow-up, and their long-term care would be taken care of here, and any long-term or maintenance medications would be handled here as well.
The Fusion Bay is serviced by the Spencer Cancer Center Infusion Pharmacy. The pharmacists work in tandem with the oncologist to provide high-quality, compassionate, efficient, and safe care for all patients receiving infusion treatment. Before a patient arrives for chemotherapy, pharmacists will review all chemotherapy regimens to determine if the patient requires specific lab monitoring and/or supportive medications. They also review insurance eligibility and approvals for utilization of more cost-effective therapies for the patient. After receiving orders from the oncologist on the day of treatment, the pharmacist checks them against national guidelines, including National Comprehensive Cancer Network, NCCN, to ensure the regimen, indication, dose, frequency, fluids, concentration, infusion times, and other crucial details are appropriate prior to compounding. A second pharmacist then performs an independent second check prior to preparation and administration. The Infusion Pharmacy is a state-of-the-art pharmacy that is divided into non-hazardous and hazardous IV rooms to ensure patient and staff safety. The right side of the Infusion Pharmacy is the non-hazardous IV room and maintains compliance with USP 797 guidelines. This work area features touchless entry, advanced refrigeration methods for drugs, and 2 laminar flow hoods in a sterile environment. On the left side of the Infusion Pharmacy is the state-of-the-art hazardous IV room where chemotherapy is compounded in accordance with USP 800 guidelines. The hazardous IV room has 2 biological safety cabinets for high-quality, sterile compounding of chemotherapy medications. All chemotherapy is compounded using a needleless closed system transfer device to allow for safe handling with hazardous medications. All medications prepared in this room undergo an additional double-check sequence in accordance with national standards. Before treatment begins in the infusion bay, all chemo is once again double-checked by the nurses as an additional safety layer. Once all pre-treatment checks have been completed and treatment has begun, patients are acutely monitored by a team of nurses, pharmacists, and oncologists. Our goal is for patients to have a safe and seamless experience before, during, and after receiving infusion chemotherapy treatment. Radiation oncologist Dr. John Kabelka and Dr. Concha Rogers, as well as their team of oncology nurses, radiation therapists, dosimetrists, medical physicists, dietitians, and other oversee care for patients requiring radiation treatment. Spencer Cancer Center has a linear accelerator with onboarding imaging and respiratory gating so that the radiation oncology team can precisely target cancer cells while minimizing damage to healthy tissue nearby and account for the motion of a patient's breathing. Brachytherapy, the implanting of tiny radioactive seeds, is also offered for some cancers, as well as stereotactic radiosurgery that utilizes the linear accelerator, allowing physicians to treat very small lesions in the brain that are either too difficult for surgery or as an alternative method of treatment.
I'm proud to be associated with the Spencer Cancer Center, a state-of-the-art facility right here in Auburn, Opelika. Not only do we have the best equipment that's available right now, we have personnel that's able to use it. We want people to feel comfortable staying at home, being around their social support system, not having to go anyplace else, and you don't have to. From a radiation standpoint, we have the linear accelerators, we have the PET imaging, which is really important nowadays because now we have the ability to isolate out exactly where the tumor is and deliver radiation right to that area very precisely. That allows us to deliver higher doses with less chance of side effects. In addition, we're also giving radiation with chemo much of the time, so we like to keep the amount of tissue in the radiation field as low as possible. We have a beautiful facility. It is state-of-the-art. It's comfortable for the patients. We're very proud of it. We have chemotherapy upstairs. We have radiation downstairs. I have integrated GYN oncology also. I'm very proud of our staff, from our administration to our therapists to our physicists and nurses. They're all caring. We get a lot of good feedback from the patients. They're very pleased with the care that they get here. And again, we're happy that they don't have to go out of town. We have immobilization devices that can keep patients in the same position. We have CT scanners on our linear accelerators, so every day when patients come in, we can do a quick scan, and if the tumor happens to be off even millimeters, we can see that on the computer screen, and we can make adjustments that tell the table to move the patient in, out, up, down, left, right. Very high precision radiation delivery. That also allows for us to cut down on the amount of treatment time. Here at the Spencer Cancer Center, we're able to treat 99% of the patients as far as their cancer diagnoses. For most of the diagnoses, you can stay right here in town and you'll receive the same care as you would if you went elsewhere. Getting a diagnosis of cancer is a life-changing event. Going through the treatment is pretty scary, but I've got a wonderful staff. We have a wonderful staff here at the Spencer Cancer Center. Everybody enjoys being around the patients, and we try to make the experiences as nice as possible. We enjoy the holidays. We like to have fun with the patients. It's not all doom and gloom. 50% of cancer care is knowing what to do. However, the other 50% of the treatment is the personalized care that you get, and you can't beat us here. We have a great staff. They make the doctors look good. I'm very proud of them. We just have a great team, and the patients really feel that and appreciate that.
In addition to less pain and a shorter hospital stay, the state-of-the-art Da Vinci robotic surgical system at East Alabama Health, which turns a previously invasive procedure into a minimally invasive surgical procedure, promises less scarring, less blood loss, less risk of infection, and a quicker recovery overall. On staff at Spencer Cancer Center is Dr. Carrie Bevis, a gynecologic oncologist who performs these robotic gynecologic oncology surgeries. Following a procedure, patients also have access to reconstructive surgery by plastic surgeons who reconstruct the area affected by surgical removal of the cancer.
GYN oncology is a unique specialty in medicine in that it blends both the surgical oncology aspect of cancer treatment and the medical oncology aspect of cancer treatment into a single subspecialty. We deal only with women with GYN malignancy, so that would be cancer of the ovary, fallopian tube, uterus, cervix, vagina, vulva, and then this weird little type of cancer that deals with the placenta called gestational trophoblastic neoplasia. We deal with that as well. And we not only treat those diseases surgically when it's indicated, but we also treat them medically with systemic chemotherapy. And to give you just kind of an idea of what a patient with GYN cancer might experience, they would come in for their initial consultation at the time of diagnosis, or sometimes just a strong suspicion of cancer. And we talk about what the diagnosis might be, what the next step is in treatment, whether that's surgery up front or biopsy followed by chemotherapy and then surgery, or whether that's radiation or whatever it may be. We sort of help the patient hear what illness is facing them and then equip them to fight it in whatever way is most appropriate. For a patient who is undergoing surgical treatment of whatever malignancy they may be facing, just to kind of give you a snapshot of what that might look like. So a patient would come in for consultation, and we would then determine, what surgery, if surgery is necessary for her. She would then undergo her surgery over at East Alabama Medical Center, where we provide really comprehensive surgical care, both pre-op assessment, pre-op testing, surgical treatment, and then enhanced recovery care for those surgical patients over in the hospital. Once they're allowed to recover, if it's one of our patients who would benefit from chemotherapy for their respective malignancy, we will evaluate them about a month after surgery to ensure that everything is healed up and that she's not experienced any complications. And then we take that opportunity to talk with them about what kind of chemotherapy they may be getting, what the schedule would be, what benefit they would hope to gain from it. And we would introduce to them at that time their cancer navigator, who would then offer an extra layer of support to make sure that they are as best equipped as possible to navigate through the somewhat complex journey that is cancer care. We provide them detailed education on their chemotherapy regimen and the side effects that they could expect and how to manage them, when to notify the MD, and what phone number to call. We allow them to tour the cancer center, or we actually take them on a tour of the cancer center so that they can see where they're going to be treated. It provides some additional comfort and just sort of familiarity to the patient when they're feeling extremely anxious because they're in such an uncomfortable situation and one they've not likely been in before. For most of our patients, they do experience a clinical remission and enter into a period that we can call survivorship. And I realize the definition of survivorship varies greatly depending on who you talk to, but we use that opportunity to really discuss with the patient's lifestyle things that they can implement in their own lives to help them live better after they have survived this cancer, to help them live better with the side effects that may not go completely away if they've completed treatment, and just basically help them to adjust to their new normal and what that might look like. It's quite comprehensive in some cases. It includes nutrition, it includes exercise and fitness. In some cases it includes massage, and then sort of body image issues that can sometimes come with GYN or any female really cancer treatment. I do surgical treatment of some benign GYN issues. Typically, one of two things has happened there. One, there's a possibility of malignancy based on the characteristics of whatever I'm seeing on imaging, or there's some sort of blood test or other indication that this may be something malignant. The other reason that I will often operate on non-cancerous GYN cases is if there's something particularly complex about them. As an example, let's say that we have a patient who has a history of Crohn's disease and has had multiple colonic surgeries in the past, and now has either abnormal bleeding or a mass or something that is requiring GYN surgical care. Often operate on those patients simply because many times those surgeries are a little more complex than more general OBGYN would be comfortable handling. What surgical treatment of GYN malignancies might require? It requires not only a mastery of open abdominal surgery, so sort of the more traditional approach to surgery with an big open abdominal incision where you take kind of everything out the old-fashioned way, as we call it. Oftentimes, though, especially today, as surgical techniques advance, many of the surgeries that I do can be done robotically. So basically we can do very, very complex surgeries through very, very small incisions with the robotic platform. And what that translates into for the patients is often equivocal outcomes from a cancer treatment standpoint. But the patient experiences less pain, they have less risk of postoperative complications, they recover faster, and they basically just get back to life much more quickly than they would have from sort of a more traditional approach. Pretty much any type of surgery from the pelvic brim down is something that we can do, and in most cases would need to do in the treatment of GYN malignancies, because that's sort of the area of the body that it impacts most consistently.
In addition to our expert team of cancer specialists, our comprehensive model of care includes expert pharmacists, dietitians, physical therapists, social workers, chaplains, and various others who ensure that all patients receive the specialized care they deserve. The East Alabama Apothecary at Spencer Cancer Center is a full-service pharmacy that specializes in clinical pharmacy services for patients on oral oncolytic medications. Located near the entrance of the facility, the apothecary provides quick and easy access for patients looking to pick up their prescriptions before or after an appointment. Patients also have the option for medications to be filled and delivered to them in the infusion room. Pharmacists are available to discuss any questions patients may have regarding their prescriptions. The apothecary is also open to the public for general prescription refills. Snacks, drinks, books, and gift items are also available for purchase within the pharmacy for patients and guests. Looking and feeling great during treatment or as a cancer survivor is something every patient deserves. The boutique at Spencer Cancer Center provides patients with a wide range of mastectomy products, wigs and accessories, such as slip-on head covers, fashionable hats, and headscarves. Patients needing mastectomy products may meet with the boutique certified mastectomy fitter for appointment or walk-in consultations. A cancer diagnosis can be overwhelming physically, emotionally, and financially. That's why at Spencer Cancer Center, we aim to support patients and their care partners through every challenge they face. Spencer Cancer Center provides support before, during, and after treatment through financial navigation, women's health navigation, social work services, and oncology nurse navigator consultations. Our navigators are committed to educating patients on all aspects of care when it comes to treatment planning. To make the patient experience as smooth as possible, we provide individualized reviews of billing and insurance coverage to identify any possible gaps in coverage before treatment begins. Our team is here to answer any financial questions that a patient may have and guide patients and families through the cost associated with treatment. Our oncology social workers provide counseling, education, information services, and referrals to community resources for patients and their care team. They also assist with the financial challenges related to patients' healthcare needs, such as assistance with transportation for treatment, healthcare costs, Social Security disability, copay assistance, hospital assistance, medication assistance related to their diagnosis, as well as any other urgent financial needs that may arise during their cancer care. Our clinical navigators are oncology nurses who work collaboratively with the navigation team to remove barriers to care for patients under active treatment. The navigator provides in-depth patient education and assists with coordination of care and development of survivorship care plans for ovarian, breast, and colon cancer survivors. Our women's health navigators are nurses who learn a patient's needs and problems that hinder care. Working with knowledge of the community's resources, the navigator then uses a problem-solving approach to address them. Navigators also provide cancer information, connect patients to cancer resources, and lend emotional support. The Cancer Registry at the Spencer Cancer Center collects data on all cancer patients diagnosed or treated by East Alabama Health. Diagnostic, therapeutic, and outcome statistics are collected and evaluated in a database that provides easy access to information for Spencer Cancer Center physicians. The Cancer Registry also coordinates cancer conferences twice a month during which cancer cases are presented for consultation or educational purposes. Spencer Cancer Center is involved in several cancer awareness activities and screening events in the community. Spencer Cancer staff and physicians take time to speak to community groups on various cancer-related topics, as well as participate in numerous health fairs throughout the year. Additionally, East Alabama Health and Spencer Cancer Center are involved every year in the American Cancer Society's Relay for Life. In October, to celebrate National Breast Cancer Awareness Month, we co-sponsor the annual Think Pink Breast Cancer Walk, which raises funds to aid in the fight against breast cancer. The event, held at Spencer Cancer Center, usually has several hundred participants. Throughout the month of October, Spencer Cancer Center is involved in several more breast cancer awareness activities in the community as well. Spencer Cancer Center offers patients opportunities to improve and maintain physical wellness through exercise and massage programs. The Robert and Marjorie Goodson Oncology Wellness Program is a 12-week in-house exercise service available to all patients receiving treatment at Spencer Cancer Center. Cardiovascular exercise has been shown to lower the risk of recurrence in colon, stomach, esophageal, bladder, kidney, endometrial, and breast cancer. The program offers a way to educate patients on the importance of physical activity as a way of lowering the risk of cancer recurrence. Patients are assessed before and after the program to evaluate condition and improvement. During the program, patients learn and perform exercises that they can also do at home. This equitable treatment eliminates the requirement of access to a gym so that patients may continue their exercises after the program ends. Another way for patients to stay active is by joining Spencer Cancer Center's walking group. Along with the benefits of movement and exercise, the walking group also serves as a community for patients to connect with others who have faced a cancer diagnosis and undergone treatment. Spencer Cancer Center also offers oncology massages to patients. Specialized oncology massage therapists are present in the infusion bay during patient treatments and can also be scheduled for appointments before radiation treatment. As part of our comprehensive model of care, dietary services are also included at Spencer Cancer Center. Our dietitians perform comprehensive nutritional assessments and provide education on nutritional supplements as ordered by patients' physicians. At Spencer Cancer Center, we recognize that meeting spiritual and religious needs is an important part of caring for the whole person. Patients of all faiths and those of no religious affiliation have access to ministry consultation if needed. Oncology chaplains are available at Spencer Cancer Center during weekday, daytime hours. A patient's cancer diagnosis can be overwhelming. Patients and their families have questions and concerns that they need answers to. At Spencer Cancer Center, we are here to help answer those questions and offer compassion and support. Our goal is to help patients feel confident throughout their treatment journeys and provide high-quality, compassionate health care.